What kind of track do you see us being on with Omicron? It's already looking like it's going to become the dominant variant here in the UK, certainly in London within days. What does it look like where you are?
Well, right now we're watching in real time that in South Africa, for example, that 90% of people with COVID-19 have Omicron, and as you said, is taking over as the dominant strain in the UK and parts of Europe. And I expect that to happen also in the United States. This variant is clearly more contagious. It's more transmissible. New data today shows us that it replicates much quicker than prior variants. That said, there is reason for cautious optimism in that we're finding that it looks like so far, this is preliminary data. We certainly need more data, but it looks like the Omicron variant, if it infects you, is going to cause less severe disease, and certainly in people who have been vaccinated and boosted.
Right. I think the issue, doctor, is that when, as Guy was mentioning Sinovac, is that we're learning that there's certain vaccines that aren't protected or protective against Omicron. And I'm wondering then, as we look out, what kind of restrictive measures are going to be needed while we get the better vaccines to them, or the more effective vaccines to them, I should say.
Right. So we're seeing that, in fact, South Africa released the first real world data and study on vaccine effectiveness. And we're learning that people who had 2 doses of the Pfizer vaccine are 70% less likely to be hospitalized if infected with Omicron than people who are unvaccinated. So we know that even 2 doses of the mRNA shots, Pfizer, and most likely Moderna, because Moderna is a similar flavor of vaccine as the Pfizer, and certainly once you have had a 3rd shot that essentially restores your immunity to protect yourself from severe disease and from death against Omicron or any variant,
Yep.
that we can feel comfortable. So I'm highly recommending the mRNA shots if you can get them.
Dr. McBride, if that is the case, is vaccination enough? Is making sure that people get their booster shots enough? Or do governments need to take further action? We're certainly seeing significant restrictions in response to Delta here in Europe. The UK is starting to step up its restrictions as well now in response to Omicron. But if we are going to see a boosted population being able to deal with this, do we need those restrictions? What advice would you give?
Well, that is an excellent question. We know that, there are collateral harms, and there is enormous societal, economic, social, and emotional consequences to lockdowns and draconian measures. So it's really, really important that we, A, get vaccinated, B, get boosted if eligible, and then C, understand that coronavirus is here for the foreseeable future. We are going to have to live with this virus, and we are going to have to do everything we can to protect ourselves and our families and communities, which starts with vaccination. Lockdowns have so much harm that we really need to be creative, almost 3 years into this pandemic, at threading the needle between practicing safety measures against a virus and realizing that health is about more than the absence of COVID-19. That's not to be blasé about people who are suffering. And it's not to say that we shouldn't do everything we can, but vaccination is the best thing we can possibly do to protect ourselves.
So, doctor, you spend a lot of time in your community talking to people, and I'm wondering if you can give me some insight as to why there's still resistance to vaccines, and what do you think really needs to be done? What we hear a lot from DC is a lot of mandates. We're also worried about certain restrictions, which we're starting to hear from private entities. And I'm wondering, on the ground, how can you help?
So what I'm seeing is that there are a lot of people who are hesitant about the vaccines who are not anti-vax. They simply have questions. They feel like their questions are being dismissed and they are being lumped into an anti-vax category when actually they just have worries that, for example, their teenage son might be at higher risk for this rare but real potential side effect from the vaccine called myocarditis. Now, we can't dismiss people's concerns. We need to entertain them and deliver clear communications on vaccine effectiveness. The vaccines are wildly effective, but they aren't harm-free. And we need to acknowledge that people have real fears. I think we need, in this country and around the world, we need equitable distribution of vaccines. We need clear communication from our leaders, and we need creative solutions, not just lockdowns and closures of schools, for example, to protect our populations and to protect ourselves. You know, if we employed rapid antigen tests alongside distribution equitably of vaccines globally, we would go a long way to protecting ourselves and our communities.
I've had 3. I've had 2 Astra and 1 Pfizer. Am I going to need 4?
We don't know the answer to that question because we're watching this airplane being built in the air. It may turn out that we need to have an annual booster for the next variant of the coronavirus, but we don't know that right now. What we do know right now is that 2 doses of the mRNA shots or a single J&J shot and a booster with an mRNA, Pfizer or Moderna, does an excellent job of protecting most people who are healthy and young at protecting them from severe consequences of COVID. And then if you've had 3 shots and you're at higher risk, you are protected very well against death and hospitalization, severe disease. And if you're younger, you're also protected well against infection. But the risk can never be 0. We cannot boost our way out of the pandemic. We cannot boost our way to COVID 0.